that sense of it, but reduces how it changes in the prostate, because the prostate needs testosterone to grow. Okay. Then also anticholinergics but finally, if all the medical treatment does not work, the next thing is surgery. Either because they've had acute urinary retention, or they have other complications. And there are different kinds of surgery. There's TURP, which is the commonest one. They go straight right into the bladder through the penis that way. They put that tube and that machine, that's not a machine, that equipment there, and then they enucleate the prostate. And that's a very big word. What it just means is that they scrape it out. So the shell is still there, but they scrape the prostate out. I think I have a picture somewhere. So you're left with something like this. So that's the prostate. So they go and they strip it out. So you're left with that big hole there. Yeah, okay. It's generally done under general anesthetic. There's a significant risk of bleeding, and sometimes we put a cast in because of bleeding. There are also risk factors there. Yes, sir.
Just a quick question on the surgery. So does that mean that once the prostate is taken off, you then have sex, for example, then you have that risk of ejaculating with urine as well?
Good. Yes, it's part of the complication there. Yeah.
That's fine. You're supposed to go back to school.
Yes. So now, even the first things first. Yeah. So that's one of the complications that can arise from, and it's there. I'm sorry, my slides, as I said, are wordy. So first of all, that sphincter there, which is like a valve that stops you from, that stops the urine from going out all the time, can sometimes be damaged. And so some people can develop incontinence of urine. They cannot control things very well. So there's a risk there. Then the other thing is that you lose that, you're quite right, you can get what we call retrograde ejaculation. And what it means is that when it's time to ejaculate, it blocks up the tube going this way. Okay? So the ejaculation comes down this way. Now, if the prostate is gone, you can, not all the time, some people don't have it. You can have what we call retrograde. So you feel like you're ejaculating, but the ejaculation is going back the other tube. So it's going into the bladder, you understand that? So if the tubes come down this way, rather than come down, it's going into the bladder. So that can happen, yes. And then the nerves, there are a lot of this basket of nerves that are here. That also can be damaged with the high energy current, and that can result in impotence. It's a small risk, but that can happen. I think I'm the one not doing this thing right now. Also, sometimes they do an open prostatectomy, which is like the proper operation. They take out, they get a scar here. And they do that for very large prostates, or whether they want to do another thing, they think there's something else going on. And that can be done under robotic surgery and things like that these days. I'm not going to go into. Now, there are new treatments that are coming up that have less risk factors. So rather than in the past, what we do is we use this high energy current and heat to cut out the prostate. Now they're using laser, which is more, it's more fine and doesn't damage all those other organs I mentioned, the sphincter, it doesn't damage things. And also they're using microwaves. It's not everywhere, it's not very, very common yet, but there's some centers in England, there's some centers, I think it should be in Scotland in the next year or two, where they can use laser, they can use ultrasound, they can use water vapor. So there are some good technologies coming up from this area. And those ones, because you're using water vapor, you're using ultrasound, you're not killing the cells that way, so you don't damage a lot of things. So it doesn't cause impotence and things like that. And then arterial. Now, let's go. These are the places where I think we should spend a bit of time. How can you prevent your prostate getting big? The data from the prostate cancer research suggests that a diet low in fat and red meat and high in protein and vegetables may actually reduce the risk of symptomatic BPH. And those are the kinds of food to avoid. red meat, canned foods, dairy, processed foods, soy, sugar, and high foods in fruits and vegetables, omega-3 fatty acid, flax seeds, pomegranates, vitamin D, green tea has been shown to help. If you take lots of that, it reduces the risk of having BPH.
No.
Yes, sir.
Funny question.
Yes, sir.
If you drink a lot of green tea and still eat your red meat.
Well, you're passing it out. There's no effect. Yes, sir.
That's prevention.
Yes, prevention.
You already have it. Doing this will not.
No, it still helps, sir. It still helps because once the prostate keeps growing anyway. So what we know is that those foods reduce the growth rates. So even though you have symptoms, it reduces the rate at which it gets worse. So that's what I would say.
Doc, just
Yes, of course.
I want to take a picture and send you.
Yes, the slides are. Now, herbal and dietary supplements, and I wanted to talk about this because there's so much on the internet and things. Now, there are a number of herbal formulations. If you go to Boots, Hollands and Barracks, there's a lot of things, prostates and all that stuff. Now, the evidence from rigorous trials is lacking, but anecdotal evidence actually supports some of it. Anecdotal evidence is that that patient used it and it worked for him. But maybe when they take it to trial, big trials, it might not be statistical enough to grow. And these are some of the things. Herbal supplements, saw palmetto, I don't know what it is a fruit, American dwarf palm fruit, some sort of thing. But some people they've refined it and they're in capsules now. If you go to Boots, you see it, prostates or things like that, saw palmetto. South African star grass, I don't know what it looks like, but I'm sure it's one of those things that my grandpa used to boil. So, African plum tree bark, the bark of it sounds like all these things they use for our food in Nigeria. Stinging nettle roots. Now, there's been research done on rye pollen, and the research suggests that there's actually good improvement. And then pumpkin seeds also helps, and that is research. I mean, this is not just they said, this is research. Now, okay. Yes.
You want to go back? No, on the herbal supplements you mentioned.
Yes.
I think I was reading some information as well in terms of some of the side effects of this. Can you talk a little bit about it?
Thank you very much. So some of those herbal things have side effects, and that is why even if you're going to take it, I would prefer the ones that have already been purified and put in tablet form or something like that, because they've probably extracted what's good out of it. Because the problem is that in Agbo, for instance, when we used to take Agbo in Nigeria, then Agbo is herbal. There's no measurement. They just give you a cup. You just drink it. So we don't know. And then, I mean, I know our forefathers have done these things very well, and they boil. When you boil it, some of the things escape, but we don't know full content of what is in it. And some of these things can have problems that can cause liver issues. And then some of us are already on other tablets, and they can interfere with those tablets. So that's why if you're going to take anything, probably those ones that have been purified, maybe more expensive, but because they've been purified, they've taken what's good out of all of these things and they've extracted them, they might be better. So, I mean, I personally do not advise that you should just start taking those supplements if you don't have any issues. If you have issues, then you do it. I personally feel that other lifestyle changes without taking supplements are the best. Your diet, your lifestyle, exercise, red meat, and all that is probably better, because the prostate will grow big, but it might not cause any problems. But if you already have issues, then if you want to take anything and you don't want to take normal medicine, those herbal things are better. That's what I would advise. Yes, sir.
Thank you, Doctor. I think you've answered my first question about this dietary stuff. It shows that is not actually for prevention. Yeah, you've answered that one. Now, before we move to this prostate cancer stuff, I think I can pick up from what you said that prostate need testosterone to grow. Yes, that's what you said just now. Is that a way that we can, and you gave me statistics that we find in African men, high rate of this prostate issue that we mentioned about. Is there any scientific work that has been done so that at a particular stage in life you can suppress that testosterone in the body so that it won't allow these prostates to grow?
That's yes, but you need the testosterone to be a man.
But at a stage, or to be a man to procreate, I think that.
No, beyond procreation. There's so many things to be a man.
If you can balance the risk of, I'm thinking of, you can balance the risk of, okay, about 60, 80, I think you already spent most of it, and you don't want to leave.
That's when you need
Testosterone is protective. Testosterone has its uses. And the problem is actually not the full testosterone itself. Is the you wanted to ask a question? You wanted to answer it.
when you are done.
You want to answer it?
No, when you are done.
Oh, right, okay. So it's the peripheral conversion to DHES that is the problem. So the testosterone, because actually when you're 18, that's the peak of your testosterone production. When you're 18 to 21, that's a peak. So testosterone actually starts to climb down after. But there's a lot of peripheral seroconversion. What I mean peripheral is that in the tissues that use testosterone, they now start to convert it more into the products that causes the process to be big. And they also convert it in your, that's why you start to grow bald. It's the testosterone that's causing it. It's called androgen. You start to grow bald. So they convert here, So there's seroconversion there. Now, if you don't have testosterone, now, people that don't have any testosterone at all, none at all, that's a woman. You start to grow breasts. If you don't have any at all, you start to grow breasts, and your voice changes back to, and hips, did you say? Hips. Yes, you start to grow hips, you start to grow breasts, your voice becomes whatever, and testosterone is also a little bit, it gives you, so people that have excess testosterone, they are very macho, proper macho. They are the ones that get in trouble, they are in prison most of the time. So you need some to give you that madness. But testosterone is madness. That's why there's this constant battle about, what do we call it now? Female athletes, or male athletes, because they've been exposed to testosterone, their bones are stronger, because it causes stronger bones. Their frame is different, the muscles develop, so testosterone is needed. But when you grow older, it starts to change. But the answer to the question is that we have blockers, but we don't use those blockers except in prostate cancer. Yes, please, sir. Sorry, I have my time.
Just a few questions.
Yes, sir.
I want to ask.
Can you use the mic and speak because
Okay.
of those online?
Okay, I want to ask about hereditary factors.
Yep.
Is there anything that is related hereditary? That's one.
Okay.
Then secondly, I also want to know about, you were talking about prevention.
Yeah.
For people who drink a lot of water in the night when leaving, as the case may be, naturally you will be going out much more. So does that have a risk factor in it? You stop drinking plenty water or a lot of water in the evening? Then another thing is that I've seen situations where you see some older people pee without knowing. So if that's that one, and they're not finding it difficult to pee now, but you just sit and before you know they pee, sometimes they don't even know. Then does it have anything to do with prostate? Thank you.
So let me start from the third one.
Yes.
So incontinence can be a symptom of prostate enlargement. And I mentioned urgency there. Now I said the symptoms are irritative or obstructive. So sometimes when the prostate grows bigger, I don't know whether you remember that picture, it's not just squashing into, it's also protruding into the bladder. So sometimes it irritates the bladder. So you don't get the, because it depends on, because the prostate has like 3 different segments. So it depends on which area is big. So sometimes you get irritative symptoms. So most of the symptoms is when they need to pee. You know, if you need to pee now, you can hold yourself, whole body for about 20, 30 minutes. But they need to pee. If I don't reach that toilet in 2 seconds, it's coming out. And sometimes they don't know. But they don't get obstructive symptoms. And that's why our brother asked, you don't have to have all the symptoms. Sometimes they just have one symptom. They can pee, but they're having a still prostate issue. Do you get that? Yeah. The second question you asked was hereditary. And I'll spend a bit of time in hereditary and prostate cancer. But there's some hereditary component to it. I'll spend some time in hereditary. And the third one was water. You know, so water, we don't tell you to restrict water except you have issues. So if you drink water and you're still waking up just once or twice at night and it's not affecting you, then you don't have any prostate, that's fine. But if you already have prostate issues and part of the problem is that you're waking up 5 times to pee and you are now drinking 2 liters at 7 p.m. Of course, you wake up 10 times. You know, so we only give you those lifestyle changes if you already have a problem, especially with water. Water is good, but we usually say after 7 because your problem is you're peeing 7 times. Please reduce the water after a certain time. Don't drink during the day. Do you understand? Yeah. Yes, sir.
Good morning. Explain the relationship between excessive sexual activity and prostate alignment. There was a video.
I'll get there. I'll get there. We'll get there. I'm sorry because of time. Yeah, but we'll get there. All of that is here. Okay. So prostate cancer. Now, as I said, there's so much information I've rushed through. I'll send the slides, and I'll answer any questions you have. Now, I mentioned that prostate will grow big naturally. Now, the growth of the cells are coordinated in a coordinated fashion. The way the body is and the way God has made our bodies is that the cells are meant to grow in a coordinated fashion. It's meant to be coordinated. And at a certain time, some cells, after they've grown and they've changed and they grow old, there's something we call apoptosis, and I'll explain. The cell dies automatically. The cell will just die. Just, that's part of it. That's the way God created us. Now, when it becomes cancer is when those cells refuse to die and they start to grow. They don't listen to command again. They start to grow in an haphazard fashion. And then, apart from the fact that because they don't listen, because the command is you're only meant to stay here, you're meant to grow to a certain extent, and then if you grow to a certain extent, you die. But they don't listen to it, and they said, no, I'm not staying there, I'm going elsewhere. That is really the basis of cancer. Because sometimes as cells grow, the DNA divides, the DNA picks up problems. And the body, there's cellular mechanisms to say that, okay, you have a problem with your DNA, so you die. That kind of thing. But then cancer, when they acquire those mutations, they don't die again. That's when cancer recurs. And that's the same thing with prostate cancer. Prostate cancer is the second most common cancer in men worldwide. And it's the 5th most common cause of cancer death worldwide. But in the UK, prostate cancer is the commonest cancer in men. Commonest. More than 52,000 every year on average. That's 143 men every day is what we diagnose in the UK. Every 45 minutes, 1 man dies from prostate cancer in the UK. Now, in their lifetime in the UK, amongst whites, 1 in 8 men will be diagnosed with prostate cancer. It is 1 in 4 black men. 1 in 4 black men. And will get prostate cancer in their lifetime. 1 in 4. Sorry? In Africa, actually, I think it's maybe slightly higher. I don't have the figures for Africa itself.
No, I thought Africans in the UK.
Yes. Black British Africans, yes.
No, because,
Do you understand?